Last Monday, May 22nd, at 2 p.m., a meeting was held by the Randolph County's Opioid Drug Community Collaborative, where our county leaders sought to educate faith-based leaders in the community on a program called Faith in Harm Reduction. One of the telltale signs should have been the name of the presentation itself. Instead of faith and harm reduction, they sought to sell us on the idea of putting our faith in a harm reduction program. They failed. What is harm reduction? Well, according to harmreduction.org, harm reduction is a social justice movement based on Marxist Critical Theory that seeks to remove the stigma of drug use and focuses on limiting the risks and harms associated with unsafe drug use through various means, including providing syringes, naloxone, or Narcan, as people know it publicly, and access to testing. That's what we were told at the meeting, and that we, the faith-based leaders of our county, should embrace it and partner with them. But here's what they didn't tell us. According to harmreduction.org and their section on their website dealing with intersectionality of harm reduction with other issues, here's what they didn't tell us. They didn't tell us that harm reduction is against local DARE programs and claim that they do not work. They teach that abstinence education does not work. They don't tell you that harm reduction is based on the same Marxist critical theory that brought us critical race theory. They don't tell you that they fully support CRT and blame most of the world's problems on white supremacy. They said, "We support the abolitionist call from activists around the country to defund, disarm, and disband the police and redirect resources to black communities." They did not tell us that they are pro-trans movement and believe that they suffer systemic discrimination. They did not tell us that they are outright socialists, fighting to transform housing from a vehicle for individuals' profit into a collective, socially controlled good. They did tell us that they want to remove the stigma of drug use by eliminating words like addict, abuser, and illegal. They did not tell us that they are for decriminalizing sex work and advocating for legislation that protects sex workers' rights, and that is central to their mission at the National Harm Reduction Council. That's what harm reduction is all about. Look, this is not the compassionate solution that they promised. Randolph County is the most conservative county in North Carolina, and some of her county leaders are advocating for full-on socialism under the guise of harm reduction. During the meeting, we were told about the great utopian benefits of giving drug addicts clean needles. One speaker asked how many in the audience wore their seatbelts and then quickly joked that law enforcement in the room should close their eyes. But asking law enforcement to close their eyes to illegal drug use is exactly what harm reduction supporters are asking them to do. And then they talked to us about syringe exchange successes. They boasted of the successes and offered stats, but let's look at those stats and easily see how they are absolutely horrible. Since needle exchange programs were legalized in North Carolina in 2016, 19.4 million clean needles have been distributed. Now, you're supposed to bring an old needle and exchange it for a new one. They boast of reclaiming 6.9 million of those 19.4 million needles. That's 35%. That means that 65%, or 12.5 million needles, are not properly disposed of. So where are these needles that aren't being returned? Well, they're on our streets and our sidewalks. Last week, there was a video released that showed used needles all over the sidewalks of streets in Asheboro, our county's largest city. Since 2016, the Needle Exchange Program has interacted with 220,173 people, with 12,113 of those people being referred to treatment. Now, that's a little over 5%. But wait, 5%'s terrible. But those numbers are actually way worse than that. Last year, 116,977 people were reached through this program in North Carolina, but only 2,147 were referred to treatment providers. That is a staggeringly low 1.8%. This program is a massive failure on that number alone. Harm reduction does not help rescue people from drug addictions. Randolph County leaders told us how the real benefits of harm reduction is that it reduces HIV and hepatitis C by getting people tested. But Of the 116,977 contacts in North Carolina last year through this program, less than 1% of those people were tested for HIV, and even less were tested for hepatitis C. Their biggest selling point is actually their biggest single point of failure by the numbers. We were told that needle exchange programs work and that it does not encourage drug use, but the data shows the exact opposite. Looking at the year-over-year reporting by the North Carolina Department of Health and Human Service, you'll see a marginal increase in new people coming into the program, but the total number of contacts rises by a large percentage year over year. Now, what does that mean? It means that when they brag about the number of overdoses they respond to with naloxone, they're actually the same drug users over and over and over again. They're giving people needles and even being with them in person or on the phone while they do drugs, and then administering naloxone to those same addicts that they are funding. Harm reduction is harmful. These numbers don't lie. They're public record and reported by the North Carolina Department of Health and Human Service. It's not compassionate. It's criminal and it's cruel. For those outside of Randolph County, please pray for us as we fight this Marxist program disguised as a faith-based initiative. And for those in my county, ask yourself why the Assistant Health Director at Randolph County Public Health, in the most conservative county in North Carolina, would support a morally corrupt and statistically failed program such as harm reduction and advocate for it. It's also high time that our Randolph County Board of Commissioners clearly state their position on this issue. Our 5 Republican commissioners need to let their constituents know if they are supportive of this Marxist program. And lastly, please pray for the faith-based leaders in Randolph County as we work to present a true faith-based program that connects addicts and their loved ones with the changing power of Jesus Christ. Before you go, let me share one more bit of horrible news with you. I was able to collect about 8 different programs, literature on harm reduction that they give to people as they enter this program. All 8 of those from 3 major cities in the United States and from 5 major university campuses in the United States. All of them have a simple 3-word statement on them that ought to shock every one of us. And it is these 3 words: enjoy your high.